I'd like to call the Committee on Rules to order. Clerk, please call the roll.
You have a quorum, Madam Chair.
Thank you. Okay, the rules, as we established last week, as relating to testimony being taken on virtually still stand. If you have not signed up prior to the start of the meeting, we will not be taking any virtual testimony as people sign up once the meeting has started. Also, I noticed that individuals, senators have signed up to speak. I'm going to be taking these bills in categories. I will start with the category of designations, then I will move to legislative studies and actions, and then I will move to executive branch studies and actions. So if you have bills in various categories, you may have to be sitting here until I get to that particular category. So enjoy yourself, take a rest. Okay.
Oh, and I thought it was funny yesterday.
Okay, so let's start with the designations. And committee members, I would actually like to do these in a block, but I would begin with SJ 49 because Senator Mokai has asked that that be stricken from the docket.
So moved. Second.
It's been moved and seconded that SJ 49 be stricken. All those in favor, please say aye.
Aye.
Those opposed? Okay, so that one is stricken. SJ 46, Senator Williams-Graves wants to designate December in 2024 and each succeeding year as Chest Wall Deformity Awareness Month in Virginia. SJ 48, Senator Stanley wants to designate March 31st in 2024 and each succeeding year as First Robotics Day in Virginia. SJ 61, Senator Perry wants to designate May in 2024 and each succeeding year as Progressive Supranuclear Palsy Month of Awareness in Virginia. SR 6, Senator Carol Foy is commending the Honorable Dr. Luke Etorian for his years of service as a pastor in Prince William County. Is there any of these resolutions that anyone would like to pull from this block?
I move to report the block.
Second.
It's been moved and seconded that we report each of those resolutions in the block. All those in favor, please say aye.
Aye.
Anyone opposed? Those resolutions are reported. We will now move to the legislative studies and actions. We will begin with Senator Hackworth, I believe you have one in this. Hold on, let me check. Don't get up yet. Yes, Senate Bill 226.
Thank you, Madam Chair, members of the committee. Good morning.
Good morning.
So Senate Bill 226 deals with the state's highway use fee program. And this highway use fee was created in 2020 and is managed by the Department of Motor Vehicles. It's meant to make up for the fuel taxes that drivers with fuel-efficient and electric vehicles spend less on. And this fee goes toward the Commonwealth Transportation Fund. The issue with this calculation is this. I'm going to read to you how you have to calculate this. I have a car sales dealership here, and so when we sell a used vehicle, the calculation is based on the vehicle's combined miles per gallon rating, the fuel tax rate at the time the vehicle was registered, the average number of miles driven by all Virginians, and the highway use fee is 85% of the difference between taxes paid by a vehicle with a 23.7 rating and taxes paid by a vehicle using the manufacturer's combined MPG rating based on the average number of miles driven by all Virginians. So with the independent auto dealers out there, that's a very complicated formula for them to try to calculate. And what happens is if they don't get that exactly right and they're audited and they owe Miss Jones $10.04, they have to try to track her down and send her a check. If they have overcharged, they have to track her down and send her a check back for the overpayment. So what this does is this asks that this committee would send this into a work group to determine the feasibility of implementing a tiered flat rate system, so it'd be easier for our smaller independent auto dealers to accurately determine the correct amount of highway use fee to be charged at the point of sale of the motor vehicle. So basically, it's just trying to help our independent dealers that they can get it right, that they can look when they're selling a model, a certain make and model of vehicle, that they could say, okay, it falls in this category, and that would be the fee that they would charge at the point of sale. And I do have someone here to speak to this from the Independent Auto Dealers Association, and then answer any questions. Thank you.
Any questions to the patron from committee members?
Madam Chair,
Senator Abbott.
just to ask, is someone from the DMV here, or have you spoken to the DMV about this?
Yes.
1 minute, please.
Madam Chair, members of the committee, I'm Gonzalo White with the Virginia Independent Automobile Dealers Association. We've had,
Are you from the DMV?
no, sir.
Oh, okay.
But we've had direct conversations specific with the DMV commissioner and their staff about wanting to do this work group. Yes, sir.
Yes. And Madam Chair, I would like to say this is not a problem with the fee being collected. We understand that, the fee needs to be collected. It's just trying to get that fee correctly calculated, because right now it's, for new dealerships, it's easier because they have algorithms built into their sales systems that calculates that. But for independent auto dealers, they have to go through that long, complicated list of calculations, try to accurately come up with that. And most of the time, they don't get it exactly right. So trying to reimburse or to collect those fees from somebody that has the vehicle's been sold. So we're just asking that a work group, and we've talked to the DMV about this, and they have not opposed it. They understand it's an issue, and there's no physical impact on this, to just try to have a work group to be convened to try to help our small independent dealers to say, let's try to figure out maybe a tiered system or a flat system, or they may say, no, this is where we want to keep it, and then report back to this committee with recommendations. Thank you, Madam Chair.
Anyone in opposition? Anyone in the virtual world? Okay, we have Senate Bill 226.
Second.
It's been moved and seconded that Senate Bill 226 be reported.
Madam Chair, before you report that,
Senator Lucas.
before you report that, I guess it does not have any fiscal impact, so, okay, so I'm good.
Doesn't have to come to you, no ma'am.
Okay, that's all I'm checking for.
Okay. So the motion is to report. All those in favor, please vote aye. Those opposed, no.
Ayes 13, no 0.
Ayes 13, no 0. That bill is reported. Thank you, Senator Hackworth.
Thank you, Madam Chair, members of the committee.
Senator Head.
Thank you, Madam Chair. This is going to be Senate Bill 147, which deals with the number of deputy registrars that we would have in a locality. To give you the background on the bill quickly before we get into what it does, current code mandates that local governing bodies must pay the compensation for the number of deputy registrars that are requested by the local electoral board and the general registrar, and it provides for a minimum number of deputy registrars, but there's no upper limit. And as a result of that, you've got localities that can be hit with a request or a statement from a board of electoral board that says we need X number of people, but there may or may not be funding to pay for it. It may not have been budgeted, and there's no guidelines for how many deputy registrars that there should be. And you end up having basically an appropriation being made with people that are not elected to appropriate funds in localities. And so what this bill does is directs the state board to adopt guidance for determining the number of deputy registrars that are based on the census and that the governing body would be required to fund at that level. And then it also empowers a locality to go beyond that guidance if it was requested and agreed to by the governing body of the locality. And then it also finally directs, and the reason that it ends up before you today is it creates a work group to advise on the creation of that required guidance. And it has then a delayed enactment of January 1st of next year to give the time for the work group to pull together and come up with the number based on some reasonable guidelines. That's the bill that was brought to me. This issue was brought to me by some of the folks in Augusta County, and some of them are here, might want to speak to this and let you know what the thoughts are behind that, but that is the bill.
Are there any questions from the committee? Those in support of Senate Bill 147? You have 2 minutes total.
Yes, sir. Madam Chair, this is Tim Fitzgerald. I'm a county administrator in Augusta County. This bill's before you simply to ask. We had an issue in Augusta County this past year where our electoral board came to us, and to be fair, they were very fair in their request. They asked for one more additional registrar. However, it was mid-budget year, which caused us some problem. And in general terms, that wasn't going to be an issue. However, they quickly showed me the Code of Virginia that said, we make the number of registrars and you have to pay for them. And that seems to me like something we ought to be looking at. And in regards to the number of registrars we have, I'm not saying that we're overstaffed by any means. However, it becomes very difficult for a local government to be able to handle that during the budget year if a local electoral board can just decide how many they want to request, and we're required to fund them by the code. So we had asked Senator Head to look at this. We're in support of the bill and putting together the work group to come up with an appropriate number, much like you would see with a comp board or with our deputies and so forth. Some reasonable number that would say that how many of these registrars we should have in a locality. So we're supporting the bill. It was a real life issue in Augusta. We're appreciative of the senator to bring it to you. Mm-hmm.
Good morning, Madam Chair, members of the committee. Katie Boyle with the Virginia Association of Counties, also here to lend our support to the bill. Thank you.
Madam Chair.
Senator D.
Katie, could you tell me if this is an issue that's been raised in other counties?
Not directly to me, but I know there are certainly looking at staffing and perhaps some additional state support for staffing is something that we have talked about over time.
But the bottom line, Madam Chair, the bottom line is you've not heard about this problem anywhere except Augusta County.
Yeah, that would be correct.
Okay, thank you, ma'am.
Are there those here in opposition? Do we have anyone virtually?
Madam Chair, yes, we have one speaker. Allison Robbins, please unmute your mic and turn your camera on.
Madam Chairman, Allison Robbins with the Virginia Registrars Association, and I'm also the General Registrar for the County of Wise. The Voter Registrars Association strongly opposes this bill. We believe that proper staffing is essential to the conduction of early voting, by-mail voting, and election day voting. And in that same viewpoint, that the ability to properly staff the General Registrar's office needs to be left with the local election administrators, which is the electoral board and the general registrar. And we have very big concerns about shifting the ability to fund our office to the local governing body and letting them have a veto power over our ability to have sufficient staff to run elections. I appreciate the committee taking our viewpoint. Thank you.
Thank you. Is that it for online? Senator Eben.
Thank you, Madam Chair. I had a question and a potential amendment. I was wondering, first off, if this bill were to pass, does it prohibit a locality going beyond the number of deputy registrars recommended? I mean, like, say you have a county like Fairfax with 1 million residents, and that it was only recommended that they have, I don't know, 4 deputy registrars or 2 or something, and they wanted 3 because of the demands of 9 satellite voting locations. Are they allowed to hire more?
Yeah, Madam Chair and Senator Evan, they absolutely are. That's specifically outlined in the bill that they can exceed that just with consultation. And again, sort of to that point in addressing the concerns that the registrars have raised, the reality is there's not a recommendation. There's a minimum number that we have for everyone. But if you have larger populations, and this I really think gives the opportunity for localities to end up with more, because if the board comes back and studies and says, to your point, Senator Evan, Fairfax County, with the population that you've got, you're going to need a lot more than somebody like Scott County is going to need. And if they come back with recommendations that say, here's the population spread, you should have this many deputy registrars for each block of population, and then the localities would, by this, be required to fund that. It would just be blanket. And then if you needed more, and the electoral board came back and said, we think we need 1 more or 2 more, what that would then put it back to is just, let's do this in consultation with the localities governing board, so that they know that they can come up with the funding, and there's some consultation with that. And that was really the issue, is that absent that, the locality just gets told, you must hire these people because we deemed that it's necessary, and there's no discussion about that. So
Thank you. Thank you. And Madam Chair, if I could follow up, on line 64, it says the work group shall begin its work no later than July 1st, 2024. And because this wouldn't go into effect till July 1st, perhaps we'd want to strike those words so it would read instead on line 64, the work group shall complete its work and make public the adopted guidance no later than December 1st, 2024, because it might be kind of, I don't know if July 1st is a Saturday, what day it is, but it's just I don't think they can be counted on to begin it on the day that the bill goes into effect. I don't know if you would find that a friendly amendment.
I think that would be. I think that's fine.
Okay, so I would move that we edit the bill in that way.
Council, do you have that amendment?
Yes, Madam Chair.
Okay.
The amendment would be on line 64. After you would strike the work group shall begin its work no later than July the 1st, 2024, and it would read you would strike everything after work group. It would read the work group shall complete its work and make public the adopted guidance no later than December 1st, 2024.
Are you moving that amendment?
I move that amendment.
Second.
Moved and seconded that the amendment be adopted. All those in favor, please say aye.
Aye.
Those opposed? Okay, we have Senate Bill 147 before us as amended.
I move that we report the bill as amended.
Okay, it's been moved and second. Is there a second?
Second.
Seconded that Senate Bill 147 be reported as amended. All those in favor, please vote aye. Those opposed, no. Aye, 7, no, 7. The bill does not report. Thank you, Senator Head.
Wow.
Senator Reeves.
Thank you, Madam Chair. This is Joint Resolution 12. This was the Virginia Gaming Commission, and we had an issue that there was an additional $500,000, and I think there was some confusion when they drafted it. The attorney, Ashley Benz, inadvertently doubled the 250 because we had 250 from last year. So Amigo's got an amendment that I think remedies that clerical error and put us right back on the right track.
Thank you, Senator Reeves. Madam Chair, the amendment would be on line 54 after interim. It would strike, comma, the direct cost of this study should not exceed $500,000 for each year without approval as set out in this resolution. It would have the effect of removing any fiscal impact, and part of that reason is because the money for the consultant was passed in the budget that was passed September 14th of 2023. So we already have that money to pay the consultant.
And Madam Chair, we've already started working with the consultant. They'll have a report due for us. So we were so late in getting the budget out, we only got 2 meetings. So this continues those meetings so we can finish the work of that study group.
Okay, we have an amendment.
And I just want to understand the amendment, Madam Chair. The amendment takes the dollar amount out of the bill?
Correct. The dollar amount that was put in was to pay for consultant services, and I think that the mistake was that the money for the consultant is already in the budget, and it was passed in the budget that was passed on the 14th of September 2023. So the money is not needed for the consultant. The contract has been signed, and the money is squared away.
Okay, we need a motion on the amendment.
So moved.
Moved and seconded that the amendment be adopted. All those in favor, please say aye. Those opposed? Okay, so we have the amendment, and so that means that there is no fiscal impact.
Yes, ma'am.
Okay. So we have Senate joint, the continuation of the joint subcommittee to study the feasibility of establishing the Virginia Gaming Commission for 2 additional years.
So, Madam Chair, does that need to be referred to finance or not with this amendment?
There's no fiscal impact.
Okay, so I would move that we report.
It's been moved and seconded that SJ 12 be reported. All those in favor, please say aye.
Aye.
Those opposed? That's
Thank you.
okay. Senator Subramanian.
Thank you, Madam Chair. I have 2 bills. I can start
Only
with
if they're in the same block.
I'll start with SB 187.
Okay, let me see where that is. Okay. All right,
Special
SB 147, 187.
Thank you, Madam Chair. So this bill essentially directs the Department of Education in collaboration with the Department of Behavioral Health and Development Services and other stakeholders to develop a plan to ensure sufficient special education staffing and recruiting for school districts across the Commonwealth. And essentially where this is coming from is we're just finding, if you take some of the things that were found in the recent JLARC study, as well as kind of the experience that a lot of parents and special education students are experiencing, there's just a shortage of special education teachers. And I live in an area where people actually move there for the special education instruction, and it's supposed to be a gold standard. And we're finding special education teachers are actually quitting because they're overwhelmed. And we're basically just trying to figure out a plan for how we're going to address this long term. And so it's a pretty straightforward bill. I'm happy to answer any questions.
Okay, thank you. Are you aware of the fiscal impact of this?
I believe we have a placeholder amendment for $50,000, but I'm not aware.
Madam Chair,
Senator Deeds.
I like the bill, but I think it's going to have the consequence of adding millions of dollars to the budget. I'd move with refer to finance.
Second.
Okay. Moved and seconded that Senate Bill 187 be reported and re-referred to Senate Finance. All those in favor, please vote aye. Those opposed, no. Ayes 14, no 0. That bill is reported and re-referred to Senate Finance. Do you have a second?
Thank you. Yeah, it's SJ 14.
Okay, we have SJ 14.
Thank you. And this bill essentially asks JCOTS to look into to artificial intelligence, both the advancements and how we can leverage it and harness it and help its development in the Commonwealth, as well as potential risks and potential harms and what we can do as policymakers to address them. And so happy to answer any questions about that as well.
Okay.
Madam Chair.
Senator Deeds.
I would ask how this fits with SB 487, which I understand is on the floor today, from Senator Ayer. Are you familiar with that bill?
When this bill went through, was not familiar with it. I became familiar with it in committee, so I'm happy to entertain a motion on this one if it makes more sense to do it that way.
Do you think this fits into what she's trying to accomplish in that study?
Madam Chair, I don't remember the specific language of that, but if I recall, it's similar. My thought was I don't remember exactly who's the one studying her bill, but yeah, I've been on JCOTS the last couple of years, which is why I thought JCOTS might be a good place for it. But I'm happy to move forward with that path as well.
Senator Favola, then Senator Boyska.
Chair, I actually serve on the Joint Commission on Technology and Science, and excuse me, what the commission usually does is we create one study that incorporates the various elements of the bills that are referred to us. So the commission will put everything within a umbrella context and figure out how to move forward. We're continuing to study this topic. It's complicated. It is extraordinarily complicated, and I don't know. I don't know if we're going to be able to come up with any magical recommendations, but I am comfortable with the joint resolution, and we'll make a motion when you are ready.
Thank you, Madam Chair.
Madam Chair, thank you. I restarted the ITAC board a few years ago and sit on that. We're actually looking into these kinds of things already. Just this past summer, we had a meeting on artificial intelligence. So there is work that is ongoing. I don't know if we need an additional board or study to do that since the ITAC board is already undertaking a lot of that work. I don't know if there's anybody here from who could speak on that, but I just worry that it might be duplicative.
Madam Chair, what I'd propose is that we report and refer this to Finance so that we can mesh this with Senator Aird's Bill 487. I know it is. Well, if we're doing, I just want to make sure that if we're doing something different from what you're doing, if we're not doing something different from what you're doing, we don't need it.
We don't need this. Don't need this one. Right.
Okay, so what was your motion, Senator?
Motion was to report and refer to Finance.
It's been moved and seconded that SJR 14 be reported and re-referred to Senate Finance. All in favor of that motion, please say aye. Aye. Those opposed? Okay.
Thank you.
Thank you. Senator Aird.
Good morning, Madam Chair and members of the committee. Before you is Senate Bill 490, and I believe there is a small substitute to simply change the date from December 1st, 2025 to June 1st, 2026.
Thank you, Madam Chair.
Substitute or amendment?
It's actually two line amendments. One of them is on line 54 to change the name of the committee, and the other one is to change the report date from December 1st, 2025 to July 1st, 2026.
Thank you so much.
Okay, go ahead.
Okay, well, you want to adopt those amendments?
Oh, let's adopt them. It's moved and seconded that the amendments be adopted. All those in favor, please say aye.
Aye.
Those opposed?
Thank you. Madam Chair, members of the committee, this legislation is regarding the maternal mortality review team. As you know, the maternal mortality review team has been doing great work since 2002. However, we met with the chief medical examiner and members of the team, and we would like them to be able to make a expansion in their scope to include maternal morbidity data to help be an additional resource to really address the rising numbers we continue to see in the Commonwealth around infant and maternal mortality. However, in meeting with that team, they made it very clear that they would not like to simply be directed to start collecting this data. They want to be able to develop a full plan that would outline exactly what would be required for this team to be fully equipped to to have that expansion in their scope. And so as we met with them, they outlined what would be necessary to help them conduct and put together that plan, and that's ultimately what you see in this legislation.
Thank you, Senator Aird. Are you aware of any of a fiscal impact of this legislation?
So in meeting with them, they did say that they could do it internally, but obviously having one FTE would be helpful in having specific project managers. So they would absorb it if necessary, but would love to have the help if we are so kind to provide it.
Madam Chair, the notes I have say they need $163,000 to hire a
That's the
contractor.
same information I have.
So we did put in a request for one FTE if we are able to move forward with that. However, in meeting with the chief medical examiner and members of the team, they also said if that was not approved, they would absorb the cost and move forward with it internally.
Are there questions from the committee? Those here in support? Anyone in opposition? Quickly, please. 1 minute.
I won't take that long, ma'am. Good morning. My name is Galina Varchana. I'm the Policy Director for Birth and Color. Thank you so much for carrying this bill, and we fully support this legislation.
Thank you.
Chloe Edwards, New Virginia Majority. We support this legislation as well.
Thank you. Anyone in opposition? Anyone online? Okay.
Madam Chair, I'd like to make, if a motion is in order.
Yes, ma'am.
Okay, I recommend that the bill pass and that it be referred to Senate Finance.
Second.
It's been moved and seconded that Senate Bill 490 be reported and re-referred to Senate Finance. All those in favor, please vote aye. Those opposed, no.
I thank the committee.
Thank you. Senator Carol Foy. Oh, I'm sorry. Ayes 14, no 0. Senator Carol Foy.
Yes, good morning, Madam Chair, members of the committee. Before I begin with Senate Bill 489, Virginia Residential Development Infrastructure Fund Establishing Report, I have a line amendment.
Can we get it reported first?
Thank you, Madam Chair. The amendment is on line 25 after "and." We would insert the nonprofit development community and shall include.
Okay, we've heard the amendment. Now we'll take a motion. It's been moved and seconded that the amendment be adopted. All those in favor, please say aye. Aye. Those opposed. Okay, we have the amendment.
Thank you, Madam Chair. Across Virginia, there's a shortage of rental homes, affordable homes, and a decrease in rental homes available for low-income households. Those are folks whose household incomes are at or below the poverty guideline, or 30% of the area median income. In Virginia, 24% of renter households are extremely low income. We are facing shortage of at least 174,187 rental homes that are affordable and available for extremely low income renters. Those that fall into this category of extremely low income include seniors, students, and the disabled renters, to name a few. One of the barriers from the development of workforce housing for our teachers, law enforcement officers, firefighters, and other affordable housing options is infrastructure costs. The lack of adequate infrastructure or the presence of deteriorating infrastructure is a major impediment to new residential development. The private sector alone is often unable to cover the upfront expense of expanding, installing, rehabbing the existing infrastructure. There are localities who put funds forward to help cover those costs, but even then it may not be enough. And that's where the state funding piece comes in. The state invests heavily into providing infrastructure to entice new commercial, industrial, mega sites, manufacturing facilities, but does not have a fund dedicated to help spur catalytic residential development projects. There are other states that do have residential development infrastructure funding and grant programs, such as Massachusetts, Wisconsin, and Indiana, to name a few. So how do we fix it? Senate Bill 489 will address this issue by directing the Department of Housing and Community Development to convene a technical advisory committee to develop draft legislation establishing a Virginia Residential Development Infrastructure Fund, with a report to be submitted to the General Assembly no later than the first day of the 2025 regular session. This does have a fiscal impact of approximately $19,500. However, we do believe that that cost can be absorbed into the Division of Legislative Automatic Systems, and I can answer any questions.
Are there any questions from the committee with regard to Senate Bill 489? I have one question, Senator Carol Foy. Although this is creating the fund this year, will there be a need for funding moving forward?
Thank you, Madam Chair, for that question. And so that's something that hopefully will come out of the conversations that will happen from the Department of Housing and Community Development. They will convene to determine what it looks like, the parameters, how much funding is needed, because we just don't have those answers right now.
Senator Favola.
By the infrastructure fund, I mean, we do have an affordable housing trust fund, and it's some of the dollars that pass through, some of the federal tax credits that pass through that fund can be used for developing the land, which is, I think, where you're getting at, putting, water pipes in, ensuring that electric power is available, if that's really what this is. So I'm trying to figure out how different will this be from the funding that flows from the Housing Trust Fund that can also be used for the same purpose?
Yes, Madam Chair, Senator Favola, thank you for that question. And so different jurisdictions have different provisions on how they believe the Public Housing Trust Fund money can be used. One of the things that we're noticing is that for affordable housing projects, it's not necessarily being attributed to infrastructure. It's more to development and enticing the developers to come into communities for different reasons. So what we want to do is have guidance and guardrails for different localities to say this is how much money that we will make available to address the infrastructure challenges that many localities are facing, and they can draw down those funds, which will be used specifically for infrastructure and not so much for the other needs that are brought to the forefront that the Public Housing Trust Fund can address.
Additional questions from the committee? Okay. Are there those here in support of Senate Bill 489? Anyone in opposition? Anyone online? Okay. Okay, we have Senate Bill 489.
Oh, Madam Chair.
Senate, go ahead.
My apologies. I guess I move that we report the bill and re-refer it to Finance.
Second.
It's been moved and seconded that Senate Bill 489 be reported and re-referred to Senate Finance with amendment. All those in favor, please vote aye. Those opposed, no. Ayes 14, no 0.
Thank you, Madam Chair. Thank you, members of the committee.
Okay, that completes everyone except members. So we will begin with you, Senator Favola.
Forgive me, Madam Chair, I'm having multiple conversations. Are you on my bill, Senate Bill 59? Okay, I can quickly tell you this bill is a Section 1 bill, and what it does is it directs the Department of Medical Assistance Services to convene a work group with stakeholders. We want to come up with recommendations to enable more people to use the Medicaid Works program. Just very quickly, the Medicaid Works program is available to folks on DD waivers. The program provides fewer supports for individuals, but allows them to earn considerably more money than they could otherwise. And some folks really can't function well on the Medicaid Works program, even though they want to. So we need to figure out if maybe a few more supports should be added to enable folks to work more. And that's the purpose of this bill. So it's just a Section 1 bill.
Any questions to Senator Favola with regard to Senate Bill 59?
Madam Chair, it is a recommendation from the Disability Advisory Commission.
Anyone here in support? 1 minute.
Hi, Mary Antoinette. Thank you, Senator Favola, for always making sure that people with disabilities are on the front line. Thank you.
Anyone here in opposition? Anyone online? Need a motion? It's been moved and seconded that Senate Bill 59 be reported. All those in favor, please please vote aye. Those opposed, no.
Thank you.
Next, we have Senator Boysko, Senate Bill 311.
Thank you, Madam Chair. Senate Bill 311 is a violence interruption service. It calls for an amendment to the state plan for Medicaid assistance services to include a provision for payment of medical assistance for violence prevention services. The bill also calls for DMAS to convene a work group to advise the Board of Medical Assistance Services on the design and implementation of a violence prevention service benefit. Every year, we know that Americans arrive at hospitals with violent injuries. Trauma experts know that when people show up injured, they often need more than a stitch to heal them. And that's why a growing number of hospitals and care providers across the nation are embracing hospital-based violence intervention programs to combat the revolving door of violent injuries in communities. Violence prevention services are evidence-based, trauma-informed, and culturally responsive preventative services provided to reduce the incidence of violent injuries or re-injury, trauma, and related harms, and promote trauma recovery, stabilization, and improved health outcomes. They are predominantly delivered by violence prevention professionals who work as non-licensed healthcare providers in coordination with other licensed providers. These services are currently provided to a limited degree, funded through general fund dollars through the Virginia Department of Criminal Justice Services. The work group that we're talking about here will determine how to implement coverage by through Medicaid, allowing hospital-based violence interruption services to receive funding through Medicaid with matching state components. I worked over the past year with the Hospital Association. We believe that our work group should be able to come together without needing extra funding. This is something that is important. Yesterday, we had a press conference talking about the toll that it takes on our communities. This would be a really positive step in the right direction to help our communities heal and slow down the violence that we're seeing in our streets, especially in our predominantly minority-majority communities. And I hope that you will refer it on to the Senate Finance Committee.
Senator Marston.
Thank you, Madam Chair. Question for the patron.
Go ahead.
Thank you. What is a qualified, I'm just looking at the summary. Could you review what a qualified professional would be in violence?
Sure. So it would be a person who has, actually, I've got some witnesses that might be able to clarify it a little bit more, I think. I think that someone from Giffords is here to speak to it, or from the hospitals. But it's a community-based person who can come in and basically work with the individuals to help provide services, to help them connect with resources to try to get them on the right track, basically. It is a less expensive way than sending, than not trying to stop this process.
Madam Chair, just follow up. Thank you. Would this require a certification of some kind or the completion of a course? Because, probably there are mental health professionals who could, provide such services, but, is there going to be anything required for this specific?
Madam Chair, Senator Marsden, this is part of the process of working through this. There are grants, there are different organizers that are already doing a lot of this work in our communities, especially here in Richmond. This would basically allow those violence interruption groups like the Health Alliance for Violence Intervention, like the Virginia Community Violence Coalition, and other groups that have already been doing this work to actually get reimbursed through Medicaid. And I do have a couple of people here who could speak on the bill.
Senator Hashmi, did you have a question?
Well, I just...
Okay,
Madam Chair, I'm not sure if this is helpful, but just in response to Senator Marsden's question, it's my understanding that the teams that are available in facilities, our hospitals, particularly our trauma centers, they have a team in which there are qualified and trained individuals who immediately step in to address the concerns around community violence, help families, and help the community go through the process of healing. That's been my understanding. Thank you, Madam Chair.
Senator Lucas.
Yes, Madam Chair. As much as I like this piece of legislation, it does have a significant fiscal impact. And so at such time as is necessary, the motion needs to include that it goes to finance.
So I'll move that we report.
Not yet, not yet. Those here in support of Senate Bill 311, 2 minutes total.
Good morning, Madam Chair, members of the committee. Thank you, Senator Boysko, for carrying this legislation. To answer, in part, Senator Marsden's question, this is a very specific type of healthcare worker, often with lived experience with violence from the community, that can serve as that link between the care that they get and the community. And there's extensive training that goes on, and I believe in the legislation it lays out a process through the Virginia Certification Board to do that. We support the legislation. Our hospital-based violence intervention programs have been really life-changing in communities across the Commonwealth. Many of you have them in your districts, and we hope it'll be the will of the committee to send this up to finance.
Madam Chair, Dodd Bark with Giffords and the Virginia Community Violence Coalition. As Senator Boysko stated before, this is something that the Commonwealth already invests in. This just gives us another tool in the toolbox to make sure that these programs are sustainable as opposed to asking for grant funds year after year after year. Thank you.
Hello, Chloe Edwards, New Virginia Majority. We're strongly supportive of this bill. Gun violence is the leading cause of death for children in Virginia, and specifically community-level adverse childhood experiences impact disproportionately communities of color. There are credible messengers or violence disruptors. Myself am a healing-centered engagement practitioner as well that can serve communities and have the shared experience to turn things around and provide support for the healing journey. Please support this bill.
Hello, Mary Antoinette. I'd like to say that I am in support of this bill. I'd also like to say that there is a clear distinction between violence prevention and mental health. Please do not put them in the same camp. One can provide, clinical support, and the other one is actually working more with getting probably even more bang for your buck. We're preventing. So let's really consider that. Prevention is the model that we should be going for. If I can say one more comment, in relation to the understanding of this top-down approach.
Thank you.
You're not on the mic.
I'm sorry, but I really need to.
Thank you.
Okay, thank you.
Are there those here in opposition? Anyone online? Okay.
Madam Chair,
Senator Eben.
just if it's appropriate, I'd like to move to report and we refer to finance.
It's been moved and seconded that Senate Bill 311 be reported and re-referred to Senate Finance. Those in favor, please vote aye. Those opposed, no. Ayes 14, no 0. That bill is reported and re-referred to Senate Finance. Senator Hashmi, you have SJ 18.
Thank you, Madam Chair. SJ 18 is a resolution that establishes a joint committee of 13 members comprised of 8 legislative members as well as 5 non-legislative members. That would include some of our local elected officials, labor, and academia, to begin a study to assess how the Commonwealth can address a structural reform that is necessary to allow counties, cities, and towns to be more responsive to their communities. And really, this is a question around the Dillon rule that Virginia currently is under. Virginia's adherence to the Dillon rule and the state preemption of local legislation means that our state government often prevents local governments from setting policies that are responsive to local market conditions and community needs, especially around issues such as raising labor and other economic standards to better support our working families in high-cost areas, and this especially impacts our workers of color. In addition, it also restricts local authorities' power to raise revenue and manage spending consistent with local budgets and the particular needs of their communities. And it also requires that we in the General Assembly, every session, we have to consider and pass many local bills each year that address local concerns. And so that is the general overview of SJR 18.
Thank you, Senator Hashmi. Are there questions from the committee? Senator, I'm sorry, Senator McDougal.
Stewart?
McDougal is the one that popped up here.
He's not here.
Well, that's a name that's up here. Senator Favola. I learned to read at age 4, so Senator Favola.
So there's no fiscal impact? I'm just confirming that.
None that I see, no.
Okay, then I will move to report the bill.
Second.
It's been moved and seconded that SJ 18 be reported.
Madam
All those
Chair.
in favor, please vote aye.
Madam
Say
Chair.
aye.
Madam Chair?
Senator, you didn't pop up, Senator Stewart.
I'm
Senator
sorry.
Stewart.
Something, I don't know, McDougal must be screwing with me from the airwaves or something. Madam Chair, I actually think that this could be a good idea at some point in time, but I've really got some concerns about trying to do it this year. This really is a monumental undertaking because it affects so many areas of law that really are embedded right now. I wonder if we should try to take this on, or if we should try to carry this over potentially. I don't know how the committee feels about that. But it seems to me it might be prudent to try to carry this over this year and think about it before we actually undertake it.
I'll second that motion.
We already had a motion, so is this a substitute motion?
I can be persuaded.
Okay. The substitute motion is to carry over Senate Joint Resolution 18, so we will act on the substitute motion. All those in favor of carrying over SJ 18, please say aye. Aye. Those opposed, no.
No.
You were allowed no, but the ayes have it.
I tried to overshadow some of those other voices.
But SJ 18 will be carried over. Senator Stewart.
Thank you, Madam Chair. I know that we're very short on time, so I'm going to be brief. You all recall we did a grant program last year to try to help get some infrastructure to support selling these blue catfish, which are literally eating everything up.
in the northern neck, the eastern shore, and Hampton Roads that are in the water. We actually found out that we may have put the cart before the horse, and we probably need to do some marketing on this. And so we've talked with VDAX. I believe that they are agreeable to set up a work group to help us figure out the marketing plan of this fish once it's caught and processed. I think they're supportive. I don't think anybody is opposed to it, and I think there are people in the room who do support it, and it does not cost any money. They can absorb that within the staff that they have, Madam Chair. So,
Thank you, Senator Stewart. Any questions from the committee? Those who are in support of Senate Bill 402, could you stand, please? Raise your hand, wave it in the air like you just don't care. Okay, all right, thank you. Anyone here in opposition? Anyone online? Okay, we have Senate Bill 402.
move to report.
It's been moved and seconded that Senate Bill 402 be reported. All those in favor, please vote aye. Those opposed, no. Ayes 14, no 0. Senate Bill 402 is reported. Senator Deeds, I believe you're next.
I've got Senate Bill 569. It's one of a number of bills I introduced to try to bolster the crisis response system. I've worked the substitute before you, and I think
You have a
there is
substitute?
Yes. So I'll move the substitute.
Second.
Moved and seconded that the substitute be adopted. All those in favor, please say aye.
It incorporates recommendations from the Department of Behavioral Health and Developmental Services. I've been fortunate the last couple of years to work with Professor Andy Block in his state and local government policy clinic at the UVA Law School. And I've got Allie Howe here to talk specifically about, she's a second-year student, talk specifically about this bill. So, Allie, I would hope you'd entertain her talking about the bill for a few minutes. Just scramble.
Okay, very few minutes. Thank you.
Good morning, Madam Chair and members. My name is Allie Howe. I'm a student of law and a member of the State Local Government Policy Clinic. Views I express today are my own. I'm here today to ask you to vote for SB 569, which seeks to address an immediate need in Virginia's crisis response system while also setting up the Commonwealth for long-term improvements in care. First, the bill directs the State Board of Behavioral Health and Developmental Services to authorize the limited use of seclusion as an emergency healthcare tool in Virginia's new crisis receiving centers and crisis stabilization units to be available in the same manner as currently exists in inpatient hospitals. This authority, which under current regulations is not available to these facilities, will allow the facilities to safely treat people in crisis closer to home and to help ease overcrowding in state hospitals. Second, because many systems around the country and the world are working to minimize the use of seclusion and restraint in favor of less restrictive, evidence-based de-escalation alternatives, SB 569 also directs DBHDS to convene a work group to review best practices in the use of these approaches, examine the implementation of alternative behavior management practices, and consider how best to equip Virginia providers with the training they need to promote both staff and patient well-being. This work group must report to the General Assembly by November of 2025 and may, as part of its report, propose new regulations governing these practices. With these changes, SB 569 addresses an immediate gap in Virginia's crisis response services while also positioning the Commonwealth to become a national leader in crisis care. Thank you for your time, and I urge you to vote for this bill.
Thank you so much for the presentation. Are there any questions? Anyone here in support? 2 minutes, please, total.
It's okay. Thank you, Madam Chair, members of the committee. Kirk Gleason, the Department of Behavioral Health and Developmental Services, and we thank the patron for reviewing the amendments that we submitted. The governor's position at the moment is amend, but the amendments satisfy our concerns, and we're happy with the bill.
Senator Favola.
Thank you, Madam Chair. I guess my expectation is that our crisis intervention centers would actually be employing best practices anyways, and seclusion, it can, under certain conditions, be identified as a best practice. So I'm wondering why we're going forward with this? What are we trying to change that best practices currently is not allowing?
Yes, Madam Chair, Senator Favola, current regulations don't allow for seclusion in crisis receiving centers or crisis stabilization units. So this is just allowing the department to amend or revise regulations, update regulations, so that these sites that are licensed by us would be able to utilize seclusion similar to hospitals.
Question, Madam Chair. So by seclusion, are you talking about maybe a single room, single occupancy? Or, I mean, we're not locking people up in crisis intervention centers.
Madam Chair, Senator Favola, no, we would not be locking people up. However, crisis receiving centers, we are moving towards where they can assume custody under ECOs or have law enforcement that can maintain custody under ECOs. And in rare circumstances, when we are in crisis, we can become escalated such that restraint may be necessary. And physical restraints in the middle of a crisis receiving center is dangerous and could be destabilizing to the milieu. So this is providing a tool to the providers to be able to have a safe place to de-escalate the individual away from others so that they can get them back to where we can contain the crisis and get them back home.
Last comment, Madam Chair. I would just say within the best medical practices then. I mean, it's really, I understand exactly where we're moving. I'm part of the Behavioral Health Commission. I've been working on TDO legislation for several years. So I'm going to support this, but I would wrap it around best medical practices.
Madam Chair and Senator Favola, I agree completely. This is to provide a tool for the rarest of circumstances, which then reduces the likelihood of the facilities having exclusionary criteria and then moving folks to higher levels of care when they can be safely served.
And gaining custody of individuals.
Yeah.
Okay.
Thank you.
Madam Chair.
Hello, Mary Attenat. I support this bill, but however, I would love to see it with an addition to it. Maybe that this process is now monitored as a co-pilot, because the problem is the practitioners and the providers in Virginia still need training. These practices are not being implemented correctly. You need to be put with others who actually know how to do this nationally if you're going to go in this direction. So actually put it with people, monitor it, get data, then and put it, something that you can put across the board. Virginia is not the experts in this. We need a lot of help, and people are being harmed, so please consider that.
Thank you.
Thank you, Madam Chair. My name is Jennifer Federa, and I represent Connections Health Solutions. They are the recipients of the Prince William County contract for a crisis receiving center. It has not opened yet, but will shortly with your help and your financial support. And this is, I believe, and I understand Senator Favola's concerns, if the choice is not being able to receive someone in a center like this who is severely agitated, or even worse, receiving someone and then having to physically restrain them. This is, I think, the better choice, and they do keep very good data, and thank you for letting me speak.
Thank you. Senator Boysko, it is 10:42.
Thank you. I appreciate the patron for bringing this forward as we're moving away from having the police intervene in these situations with people with autism and mental health issues and ID and DD issues. I make a motion that we report the bill and as amended. And if we need to, do we need to go to finance? No. Okay, no. Report the bill. No. Great.
It's been moved and seconded that the substitute be reported. All those in favor of SB 569 as a substitute be reported, please vote aye. Those opposed, no. Ayes 13, no 0, 1 abstention. That bill is reported. We have 2 remaining bills, Senator Pillion, and I believe you have a substitute as well.
Madam Chair, the substitute incorporates feedback from DMAS
and may eliminate some significant concerns of the 13th floor.
Moved and seconded that the substitute be adopted. All those in favor, please say aye. Aye. Those opposed?
So now the bill directs DMAS to convene a work group of stakeholders to design the certified community health workers service benefit and seek federal approval through a state plan amendment and to implement the benefit.
And the substitute also makes this a Section 1 bill, correct?
That's correct, Madam Chair.
Okay. Anyone here in support of Senate Bill 615? 2 seconds this time.
Madam Chair, Davis Gammon from the Virginia Hospital and Healthcare Association. We support the bill. We thank the patron and DMAS for working with us on this important issue. It'll be transformative for Virginians once we get to the point where we have a benefit. Thank you so much.
Thank you. 1 minute.
Good morning, Madam Chair and members of this committee. My name is Shantany Jackson. I am the Executive Director for the Virginia Community Health Workers Association and also a promotora de salud. And we are in support of this bill. Thank you so much.
Thank you.
Catherine Haynes with the Virginia Interfaith Center for Public Policy. Thank the chair and Senator Pillian for bringing this very important bill. We are in strong support, and other coalition partners, Birth in Color and Voices for Virginia's Children, asked me to share their support as well.
Hello, Chloe Edwards, New Virginia Majority. We're serve working class communities of color. We're strongly supportive of this bill. Community health workers are often who they serve. Thank you.
Thank you. Senator Deeds.
Madam Chair, this bill has a significant financial impact, and so I would move that we recommend or we report the bill and refer it to finance.
Second.
I have a question. After it changed, it removed the fiscal impact, correct?
Yes, Madam Chair. The substitute removes the provision that directed DMAS to implement this into the plan. So that was, I think, it just leaves the work group.
Just the work group.
So there's no
correct
fiscal impact at this point.
Okay, then I'll amend my motion and move the report.
It's been moved and seconded that Senate Bill 615, amendment in the nature of a substitute, be reported. All those in favor, please vote aye. Those opposed, no. Ayes 14, noes 0. That bill is reported. Senator Rouse.
Thank you, Madam Chair. SB 650, if you can remember, you all can remember back in 2012, a 12-ton Navy jet loaded with tons of fuel crashes in a spectacular fireball into a big apartment complex in the city of Virginia Beach. That was 2 days before Easter, which made it Good Friday. No one was hurt in the initial crash, Madam Chair, but obviously first responders and many from the city of Virginia Beach who responded to that were exposed to composite materials, toxic fibers, fuel. That burner was splashed everywhere. So this bill essentially directs the Department of Fire Programs to convene a work group to assess eligibility for funding, qualifying emergencies, and other criteria, and directs the work group to submit a report to the GA no later than November 1. The bill also includes a reenactment clause for the provision of the bill creating a fund and program in 2025. It does have a fiscal impact of $117,000 annually, Madam Chair, and this grant awards will provide funding for annual cancer screenings and to cover portions of healthcare costs not covered by insurance or other available resources. And I believe the city, Brent McKenzie with the City of Virginia Beach is also here if you needed him to respond to any questions.
Are there questions to Senator Rouse with regard to Senate Bill 650? Those in support? I'll give you a minute.
Yes, ma'am. Good morning, Madam Chair, members of the committee. I'm Brent McKenzie with the City of Virginia Beach. Just like to thank Senator Rouse for bringing forward this important piece of legislation that would support our local government employees, but also other local government employees who may encounter similar situations in the future.
Yeah.
So, thank you.
Anyone here in opposition? We have anyone online? Okay.
Madam Chair.
Senator Deeds.
I would just note that there is a $117,000 fiscal impact to this on an annual basis. I'd move to report and refer to finance.
Second.
Moved and seconded that Senate Bill 650 be reported and re-referred to Senate Finance. All those in favor, please vote aye. Those opposed, no. Ayes 14, no 0. That bill is reported. And I believe that clears our docket for this morning. Okay.